Hi everyone, my name is Sarah Trottier. I'm a registered physiotherapist here in Ottawa with focus on women's and pelvic health. So today we're going to talk about posture and how our posture evolves depending on our demands, depending on our habits, depending on our conditions. Kind of like the idea of if you're sitting at a desk all day, you might find yourself having a rounder back. Now, the same thing happens during pregnancy, where we see, bellies growing forward, which tends to change our posture significantly. So, for instance, when belly is growing forwards, our pelvis tends to rotate forwards as well, which increases the arch in our back. And our upper back also tends to hunch a little bit forward, causing our shoulders to also come in. So there's a lot of changes during pregnancy that can cause some pelvic pain, some back pain, and some pelvic floor issues. So a lot of people feel like after they give birth, their posture is going to change right back to the way it was. But in fact, we have a lot more demands on our body where we're holding baby in the front, where we hold them on the side, and we use a lot of our hips, when we're nursing and we're hunching back. So there's a lot more demands on the body than what we think, and so our posture has to change accordingly. So here are a couple tips to help maintain a proper alignment, especially when you're holding baby and taking care of baby. So tip number 1, always make sure that your feet are nice and shoulder width apart or hip width apart. And you want to put more pressure into your heels so you can still kind of wiggle your toes. Tip number 2 is make sure that your knees aren't completely straight. When we straighten our knees all the way, it tends to arch our back and we get a little bit more back pain with that. So make sure you have a nice soft bend in the knees, not so that you feel the burn in the quads, but that it's just unlocked. So tip number 3 is maintaining proper pelvic alignment. So in order to find where your neutral is, I always say put your hands on your hips. Try to roll your hips forward. That's rolling all the way forwards. And then if you try to roll them all the way back, and then come right back into the middle. And that's a nice neutral pelvis position. And tip number 4 is make sure that you're not rounding your back. Make sure it's nice over so that your ribs are stacked over your pelvis and that your shoulders aren't too far forwards. So play around with that, see how it feels for you. And if you have any questions, please ask them below.